Good evening, everyone. Dr. Blessin here from DentaLoupes. Is my audio visual clear? Am I audible to you all? Okay, great. So, we will have a quick image-based series, image-based the discussion from oral and maxillofacial surgery. Okay, mainly I'll be dealing with the instruments. So, I'll show you each one by one instrument. You all identify the instrument and put the name in the chat box. Okay, so we can make this kind of a live discussion. Okay, so let's begin. Can you all identify this instrument, which is there in all the departments kept in an antiseptic solution, which is used to pick up the sterile instruments and deliver to the operating field or the surgical area? Okay, you can put the answer in the chat box. Yes, very good, Priya. It's Chittle forceps, okay, which is a very familiar forceps for us. Next, identify this instrument. You can look at the tip, right? It has got a serrated end which is used to pick up a certain sterile gauze or cottons and all. What is this? Yes, it is a forceps. Priya, yes, very good. Swab holding forceps, okay? The name is swab holding forceps. The next one you have here, very familiar must be. One end you have a rounded end for lifting up the mucoperiosteum, and the other end is a bit pointed. This end is used to reflect the papilla, interdental papilla. Can you all identify? Yes, periosteal elevator is the right answer. Which periosteal elevator? You have different types of periosteal elevator. This one is number 9 Molt periosteal elevator. Okay. Then you have a smaller version of Molt's periosteal elevator here, which is this. It is more delicate, used to reflect delicate tissues, which is this one. It is Woodson periosteal elevator. Okay. Woodson periosteal elevator, smaller than the Molt 9 and delicate compared to the Molt. Another elevator. The shape is quite different. You have a rectangular end which is broad, which is termed as a Rongeur end, and then you have a broader end. Can you all identify this? It is Howard's periosteal elevator, again used for reflecting the mucoperiosteum. Okay. So, I can't see any answers coming up. We shall move ahead to the next one. Very common instrument used just prior to the extraction, right? L-shaped. The tip is at a 90-degree angle to the handle. Which is this instrument? Anyone? It is Moon's probe. Okay. Moon's probe, which is used to reflect the periosteum just prior to the extraction. And the next one, again, we are starting with retractors. This is an L-shaped retractor At the tip you have a notch here. Can you identify? This one is used to retract the intraoral flaps. No, it is not Langenbach retractor. It is Austin retractor. Okay, remember, Austin retractor with a notch at one end and an L shape. Okay, you will have similar retractors coming up. I'll show you the picture without this notch. Then you identify as a different one. I'll tell you the name. And this one, again a different type, broader one. This can depress the tongue and reflect the periosteum or the flap at the same time. Can you identify? Yes, very good, Priya. It is Minnesota retractor. Okay, Minnesota retractor. Now the next one, again in a different shape, and one end you have a heart-shaped end with horizontal striations. Can you name it? Yes, Vader retractor. You are right, Vader retractor. Okay. This is the one I was talking about. It looks like Austin retractor but without the notch at the end. So which is this one? Again used to depress the tongue. Just a tongue depressor. Okay. Now the next one, in this shape with broader ends, it is termed as Selden retractor. This is the ends are quite dull. This is not used to reflect the periosteum. Okay. The next one, the handle is quite long with a loop in between or a round in between and an L-shaped edge. This one here is Langenbach's retractor, again used for the reflection of the flaps. Now the next one here with serration. This is a forceps, right? This is a tissue forceps. What is the name of the forceps? Look at the specific shape at the tip. There are serrations towards the periphery and a small concavity in between on one side of the forceps. It is not Adson's. This one here is Russian tissue forceps. Okay, Russian tissue forceps. Now the next one, this instrument looks a bit complicated, but it is used for the simplest of the purposes. What is this? Yes, it's a towel clip. Okay, towel clips can be of different types. Again, this one is also a towel clip, but it has got a locking mechanism and this one doesn't have. So if you get questions showing these kind of images, do not go into complicated answers. Okay, now moving on to the next one. Here you have a locking mechanism, you can see, and the tip you can see horizontal striations. This instrument is available as straight as well as curved tips. What is it used for? And yes, it's a hemostat or an artery forceps which is used to arrest the bleeding by clamping into the vessels. Okay, so not this. It has got horizontal striations. The difference between a hemostat and a suture holding forceps is that suture holder has got crisscross striations and a hemostat has got just horizontal striations. I'll show the picture of suture holder later on. Now this one looks similar to the hemostat or artery forceps, but what is the difference? What is this one? There is no locking mechanism Also, the serrations are present only at the tip, the half inch from the tip. There are horizontal striations. Which is this one? It is not a hemostat. Yes, it's a sinus forceps or a sinus drain. It is used for the drainage of sinuses. How is it used? You open up the abscess and then you put this instrument inside and then you open it up. Okay, so while opening this handle, it breaks up the loculi in the abscess and it helps in draining the pus. Difference between the sinus forceps and an artery forceps is that this has got a locking mechanism and the serrations, okay, it has got serrations throughout the end, throughout the tip of the instrument. This is another tissue holding forceps which you have already named Adson's, okay. This is Adson's tissue forceps. Look at the edge. It is a bit pointed and it has got horizontal striations. We have a few more forceps to go. Look at the specific shape. It has got a very long handle and at the tip the specific shape. Remember this shape, okay? If you get a picture like this, just look at this picture and remember it. It is used to hold delicate tissues like mucosa and the lymph nodes. Yes, it's a Babcock's tissue holding forceps. And the next one here, can you all see the tip? One end of the tip has got a concavity and the other end, it has got a sharp end. So it is used to hold more tougher tissues like an aponeurosis or a muscle and all. So this one is tissue holding forceps for a tighter or a better grasp. And the next one, look at the shape at the end and small tooth shaped appearance at the tip. Alice, yes, it is Alice tissue forceps. Remember, okay? Moving on to the next one. This one is used post extraction to break up the bony spicules or an interdental septum and all. It has got a sharp end throughout the periphery, and while you press it, the pressure gets built up and it helps in breaking up those bony spicules. Which is this? Yes, it is Rongeur forceps, okay? And the next one, you have very common instruments, or it is very easy to identify, right? A chisel and the mallet. The chisel and mallet together is used for chipping off the bone. Now, chisel has got bevel at one end, and so it is placed towards the bone, and then using the mallet, you slightly tap on it to chip off the bone. You apply the pressure only using the wrist so that the pressure is controlled and the bone will get chipped off in a lighter way. Okay. Now the difference between the chisel and an osteotome. Chisel has got bevel only on one side, and your osteotome, it has got bevel on both sides. Even the function or uses of chisel and osteotome differ. A chisel is used to chip off the bone, wherein your osteotome is used to cut or divide the bone. It applies more pressure. Okay. Moving on to the next. Again, another instrument used in chipping off the bone, not chipping off per se, to remove the bone in a very lighter fashion. Which is this? It's a bone file. Bone file, when you apply a pulling pressure, it removes the bone. Okay. It smoothens the sharp borders of the socket, and it can be used to even after the after removing bony spicules, just to smoothen out the bone, you can use bone file. Next one you have post extraction. Again you can use this to remove the periapical granuloma or any abscess and all. Which one is this? Yes, it's a periapical curette. Okay, used to curette out the soft tissues post extraction. Then you have what I was talking about, with the crisscross striations at the tip and the locking mechanism. It's a needle holder. Very good. It's a needle holder, and the difference again I'll show once again. Needle holder has got crisscross striations, wherein your artery forceps or hemostat has got horizontal striations. Next one, the parts of suture needle. Okay, suture needle can be either eyed or swedged. Okay, swedged ones are the ones in which prefabricated suture material is already fixed into the needle. So you will have either a swedge or an eye at this point. Okay, then you have the body of the needle, and at the tip, this is the point of the needle. Okay. Now the needle is available in different shapes and sizes. So this is a 1/4 circle, 3/8 circle, half circle, 5/8 circle, all this. Okay. These are seldom used in our oral surgical procedures. Then the cutting end of the needle. It can be the taper point. See the point, it is just pointed with a round body. Then you have blunt point, the point is not sharp. Then you have conventional cutting, in which look at the cutting edge, the cross section of the cutting edge. The tip of the triangle or the cutting edge is towards the upper side. Okay, and in the reverse cutting needle, the cross section shows the tip of the triangle is downwards. So this one here, the reverse cutting needle is used to penetrate tougher tissues or difficult to penetrate tissues, and your conventional needle can be used for easier tissues or even delicate tissues. And then you have your taper point needle. Moving on to the next instrument, again looks very complicated, but the function is quite simple. This one is used to keep the mouth open or to increase the mouth opening slowly. What is this? No, Priya, it is not Ferguson, it is Molt mouth probe. Okay. The second one here, this one is Ferguson Ackland mouth gag. Look at the difference in the appearance. Okay. This is Molt mouth probe and this is Ferguson Ackland mouth gag. Both have the same purpose. Okay. And then you have your normal mouth probes. Simpler, it can be used for pediatric patients as well as adult patients. Next you have a needle. Okay, different parts of the needle. Let me explain it to you all. Here you have at the top part you have the plunger. Then you have the barrel in which the solution is kept. Then at the end you have the needle hub. This portion is removable. It can be fitted into the barrel. And then you have the needle at the end. Again the parts of the needle. Look at this. Here you have your shaft and then you have your lumen. At this is the bevel of the needle. Okay. Again the needle or the syringe is available in different gauges. Okay, what do you mean by gauge? It is the lumen size of the syringes. Okay, depending on the gauge, the lumen size. If the higher the gauge, the smaller the lumen size. It is opposite, okay? So always remember, higher the gauge, smaller the lumen size. And also it is color coded according to the gauges. So each gauge has got a different colored hub. Even though the entire syringe wouldn't be colored like this, you will have the color of the hub, this one, according to the gauge of the needle. Then moving on to the equipments or instruments used in extraction. This one here is your straight elevator. The parts of the elevator. Here you have your handle, then the shaft and the blade. Okay, blade, one end is a convex or flat and the other end you have serrations. Okay, and how is it used? How is the straight elevator used, or what is the principle behind use of straight elevator? Can anyone tell? The blade is placed into the pedial space, right, between the tooth and the bone, and then you apply pressure. What are the principles? So, okay, it works on wedge principle and first order lever principle. Okay, then the second type of elevator you have here, angulated tip, and it is available in pairs. Okay, right and left you have. It is used to pick up the root tips, which is this one. This one is the apexo elevator. As the name suggests, it is used to pick up the root pieces and all. Again, it works on wedge principle and first order lever principle. Another type of elevator which has the end or the blade, you see, it is not sharp. It is cut and it is flat or straight at the end. This one here is used like a straight elevator placed into the pedial space. What is the name? Again, the principle is first order lever and the wedge principle. Okay, so the name is Coupland elevator. Okay, then you have, very difficult to forget this instrument, right? It is available as right and left pair, and the end is a bit different. It is triangular. The blade is triangular. That is the difference. Yes, it is a Cryer elevator. Cryer's elevator is also used as by wedge principle and lever principle, available as right and left pairs. Okay, it can be used both in maxilla as well as mandible. Then another elevator with the same blade or triangular blade, but the handle is different. Also the working principle or the mechanism is different, which is this. It is the crossbar elevator or Winter's crossbar elevator. This applies a lot of pressure. Okay, so because this works on which principle? Yes, wheel and axle principle. Okay, wheel and axle principle brings out the best of the or the highest mechanical advantage during extractions. Can you name how much is the mechanical advantage by wheel and axle? Also by wedge principle and lever principle. Yes, very good, Priya. So the mechanical advantage is 4.6 for wheel and axle, and for wedge principle it is 2.5, and for lever it is 3. Okay, so these are the mechanical advantages. Then you have another elevator which is used only in the maxilla, more delicate. Yes, it is Warwick James elevator, which is used in the maxilla to elevate the tooth. Okay. Now the next one here, heavy instrument and a pointed tip. Crane pick elevator. Okay, it is used to pick up the small root pieces which is left in the socket. You drill a small burr hole into the deep into the root, and then you engage the crane pick into the root, and then you lift it up. That's how crane pick elevator is used. Okay. Now moving on to the next image. Another delicate instrument. It looks like a periapical curette, but it is not a curette. It is a root tip pick elevator. It is a delicate root tip picking elevator. Okay, used to, as the name suggests, it is used to pick up the root pieces. Now we have a different classification here. Okay, the Mallampati score. What is it used for? It is named after the Indian anesthesiologist Seshagari Mallampati. Okay, this classification, it categorizes the spaces and classifies the space available in the oral cavity. Okay, so here class 1 you have a complete visualization of the soft palate as well as the uvula. In class 2 you have complete visualization of the uvula only. The soft palate is partially visible. Now in class 3 you have visualization only of the base of the uvula here. Okay, and in class 4 soft palate is not visible at all. So this classification, these images you can get, and you will be asked which classification, which class of a Mallampati score it is. Okay, this is used to if there is less space, means there are chances of blocking the airway, blockage of the airway while sleeping. So it's very important to assess the oral space. Now here you have a maneuver which is used to open up the blocked oral airway. It is because your tongue is fallen back on the behind and there is a blocked airway. Which is this procedure and how is it done? Okay, as you can see in the picture, the head is lifted downwards and the chin is lifted up by pressing onto the forehead and applying pressure on the forehead and on the chin. Okay, this raises your tongue and it opens up this airway. So this maneuver is termed as head tilt chin lift procedure. Okay, it is used in unconscious patients to make sure they have an oral open airway. Fine. Next, here you have an instrument used to make sure to open up the airway, which is used in the oral cavity or passed through the oral cavity. That itself is a clue. Look at the curve here. So yeah, it's the oropharyngeal airway. Okay, and it is color coded according to the sizes, and you have a flange at the end to prevent the depth of the insertion. And then you have a bite block here. Here you have the curved tube, which is the curvature helps in the easier passage through the oral cavity. Now let's see how it is placed. See, this is how it aids in the opening of the airway. Now one important fact about oropharyngeal airway is that it can be used only in unconscious patients, okay, who doesn't have a proper or a gag reflex. Okay, it cannot be used in conscious or semi-conscious patients. Now this curved tube is passed between the mouth and the pharynx of an unconscious person to make sure the airway is open. Then another tube you have here which is used to maintain the patency of the airway, but it is used through the nose. So this is termed as nasopharyngeal airway. Okay. Now this nasopharyngeal airway, unlike the oropharyngeal airway, can be used even in conscious or semi-conscious patients as well. Okay. Even if there is a gag reflex, it doesn't matter. This can be used. The next instrument you have here, can anyone identify it? It's a laryngoscope. Okay. It's a laryngoscope. It is used to examine the larynx, as well as it is used to put a tube through the oral cavity to the trachea to make sure there is a patent airway. Now that procedure, what is that procedure? Using the laryngoscope, you can even examine the larynx, as well as you can put this it can aid in the insertion of this tube, which is endotracheal intubation. This is your endotracheal tube, and it is passed through the oral cavity and it is inserted into the lung. And the parts of the endotracheal tube I will explain here. So here you have a connector. This connector connects the tube to the source of the oxygen. Then you have the main tube, and at the end, at the distal end, you have a cuff. It's inflated, and then at the end it is beveled. Okay, what is the purpose of beveling at the end? It aids in the smooth passage through the vocal cords. Once the tube gets into vocal cords, if it is bulkier, it will be difficult to pass through. So this beveling makes it easier to slip through the vocal cords. And just beside the bevel, you can see another opening here, which is termed as Murphy's eye. Okay, this is just an opening which is used to make sure this tube is open, the airway is patent, and the flow of the air or the oxygen happens, even if the bevel is blocked due to any mucosal plugging, or the tissues of it can get attached to the tissues of the larynx, the walls of the larynx, and block the patent airway or block the passage of the air. That's why we have an extra opening, that is the Murphy eye, just distal to the bevel. Okay, so these are the parts of the endotracheal tube. I think with that I'll wind up today's session. Okay, I hope I have discussed few of the important or basic instruments and equipments used in oral surgery. Fine. And I know you all are preparing well for the upcoming exam. Tomorrow is your exam. Have a very good night's sleep and relax, and give a very good attempt. Give your best attempt at tomorrow's exam. All the best to every one of you. Okay. Thank you so much.